What is inflammation? So in the body, we have anabolic metabolism and catabolic metabolism. Anabolic is your body's building back up. Think of anabolic steroids like testosterone and growth hormone. They build your body back up. And then we have catabolic, right? Levels of building, which is your body's breaking down. All right. It's breaking down faster than it's building up. Think of lots of exercise and getting really sore, overly sore, where you have a hard time walking in the next few days, right? Think of that kind of catabolic breakdown. So when you're chronically inflamed, that catabolic metabolism is overwhelming the anabolic. Your body's breaking down faster than it's building up. So typically we have homeostasis. Catabolic, anabolic is good. That's a good thing, right? With lots of different things, because you want to break down a little bit, build back up. So you're tearing down that old scaffolding, building back up stronger. And when you're breaking down more than you're building back, that's where inflammation comes in. And of course, there's a lot of chemical messengers involved in inflammation that tend to be, let's just say, higher than normal, out of range, maybe even out of control, especially when we're dealing with certain autoimmune conditions that are inflammatory in nature, like rheumatoid arthritis, polymyalgia rheumatica. You could think of other inflammatory issues with the intestinal tract, like IBD, like Crohn's, ulcerative colitis. Okay. Any of these kinds of conditions could fall into that category. So we may see certain things like interleukins, interleukin 6, 1, 2, 3, different cytokines, nuclear factor kappa beta. You may see different compounds like C-reactive protein elevated. You may even see ANA, anti-nuclear antibodies elevated, part of an autoimmune cascade. You may see SED rate, erythrocyte sedimentation rate. These are all markers of inflammation. So the broader ones are going to be more CRP and SED rate. And then you can have some homocysteines and other inflammatory metabolite due to an insufficiency of B vitamins and or just not getting too many crappy B vitamins from junky foods like sodas and breads. And so when we look at that, we can run a test and look at interleukins and cytokines and different imbalances in these inflammatory markers. A lot of times you don't have to, because you just know the person's in pain. They don't feel good. They may have a known autoimmune condition. We may be looking at just broad inflammatory markers like CRP or SED rate. These can be good things to look at. We may see a lot of increase in clotting, inflammation in the vasculature. We may see the homocysteine or fibrinogen or D-dimer elevated. These are all possibilities, right? So we got to look deep at what the root cause is. And so the first thing is, before we talk about supplements, a lot of good supplements that help modulate a lot of these inflammatory markers. The question you have to ask yourself is, are we getting to the root cause? That's really important. Now, sometimes the root cause is an autoimmune condition. And so are you getting to the root cause of that? Maybe not. So some of the big triggers of autoimmunity, of course, are going to be food, right? Gluten, food allergens, dairy, refined sugars, carbohydrates, flours, excess omega-6 vegetable oils, more pasture-fed, not pasture-fed, but more feedlot animal products where animals are fed lots of antibiotics and soy and junky fats. So really important, you got to look at the foods.